Hello. Hi. Hi, everyone. Good. So I think there are a lot of people are joining. Yes. So let me do a formal introduction before we go ahead. So hi, everyone. I'm Dr. Mansi and I'm your Veera Health consultant. I am working with Veera for almost past 2 years now. And it's been a great association working with them and treating all these wonderful ladies who are suffering from this very common problem, PCOS. So the agenda of today is to basically discuss PCOS and infertility. And I know there are a lot of questions which are there in your mind, and a lot of girls have this anxiety of how the fertility will be, how it will happen. So we all know about PCOS. We keep hearing things what you from your friends or from your family regarding how PCOS has to be tackled or how does it affect your fertility. So I think the agenda of today is to make sure that we break down all these points, make sure we remove and discuss all the myths which are associated with PCOS so that you all understand what is actually true and what is not true. And plus how to deal with it, how to manage it, what are the treatments which are available, and we will just make sure that we cover all these things. So first things first, as we start, as we all know that how PCOS affects us, and it can be different types of PCOS which you all can suffer from. It could be a genetic PCOS, it could be a lifestyle induced PCOS, it could be sometimes because of your other hormonal irregularities like thyroid or prolactin increase in the body, which can cause PCOS, or a polycystic ovaries, which can affect your periods. So the first and foremost thing is to always identify what type of PCOS you have. Once that identification is done, it is always easy to manage your PCOS, and it gives us a kind of a framework to move about. Plus, on top of that, it also helps in getting us to the point that what you want. Of course, regularization of periods is the first thing which most of the girls look for. Second thing is getting rid of those high androgen level symptoms like your facial hair, your acne, hair loss. And third thing is your fertility, which comes into the picture. So usually we see young girls, they feel okay, no, it's getting married is something which is not on my next 5 year agenda or next 5 year plan. It's going to take time, but that's all accepted. We all understand that you're all working females now, but then you also need to understand and know your body, understand how your fertility pattern is going to be in case in future if you are interested for pregnancy. So let's just start with first why PCOS cause fertility, why we see this fertility issues in PCOS. So there are two things which are very important to understand when you have PCOS. Is one, you suffer from something called anovulation. So what does anovulation means? When you do not ovulate. So when you don't ovulate, automatically your pattern of the cycle pattern, your ovulatory pattern is gone. You don't have that proper cyclical pattern of having your estrogen hormone, your ovulation and progesterone. So normally a girl, if she has a regular cycle of a 30-day or like 35 days or like 28 days. So usually in the first half of the cycle, she secretes estrogen hormone. Then she ovulates in the middle of the cycle, and then she produces another hormone called progesterone. So this cyclicality is very important. Only and only then do you ovulate, and only then your uterus is prepared for pregnancy. So unless and until this ovulation happen, and unless and until this progesterone hormone comes in picture, these two things both are very important for pregnancy to happen or for fertility to be having a proper hormonal balance in the body. So to explain you regarding that, so first, yes, in PCOS your ovulation is not happening. It's not regular. You don't really know when you ovulate. So obviously when you don't know when you ovulate, there is difficulty in planning your sexual intercourse accordingly, because of course you don't know when should I have intercourse or when will I get pregnant, because I don't know when I'm ovulating. So that's the problem. Second thing which happens is your uterus inner lining keeps getting damaged. So automatically, if you see, as the uterus inner lining keeps getting thicker over a period of time, and that happens under the influence of estrogen hormone. So this basically damages your uterus inner lining, and when you have these long gaps in between your cycles, like you have your 3-month pattern or 4-month pattern, or sometimes some girls don't get cycles for even up to 6 months, automatically it basically makes your inner lining quite thick. It makes it more estrogenized. There is no progesterone hormone which is coming, and because of that the inner lining keeps getting damaged. This again makes it difficult for you to conceive later, because if the inner lining is not healthy, even if you ovulate, there is a possibility that, and even if you get pregnant, like that means the sperm and the egg, they do fuse to form the embryo. The embryo doesn't attach onto that lining because it becomes unhealthy. So these are the two main reasons why we see infertility or problems in getting pregnant during when you are trying for pregnancy. So how to tackle it or how to go about it? As I said, definitely first identify what type of PCOS you have. There are always some tests which you need to do if you are thinking about planning for pregnancy. Apart from your general health checkup, knowing your hemoglobin, knowing your viral marker tests like your HIV, hepatitis and HCV, VDRL, your syphilis test. So these are all general checkup what we do pre-pregnancy. Apart from that, from PCOS point of view, what you need to know is basically your hormones, which you should definitely check before you are planning pregnancy. So one is your FSH, which is basically your hormone which comes from your brain, which is responsible for regulating your cycle. Second is your LH, again comes from your brain, which helps in ovulation. And if this LH-FSH ratio is disturbed, which is actually the reason why PCOS happens or that PCOS symptoms come, this abnormal FSH and LH ratio needs to be regularized before you start planning, or at least this high LH levels need to be brought down before when you're planning for pregnancy, because otherwise the ovulation doesn't happen. And based on these reports only, your doctor decides whether you need ovulation inducing drugs, what kind of medications do you need, whether you need injections or not. So definitely LH, FSH needs to be checked. Third hormone which you need to definitely check is your TSH, that is your thyroid hormone, because thyroid also regulates your ovulatory pattern. If your thyroid hormone is not correct, it automatically does affect your ovulation. The quality of egg also gets affected, so that also needs to be checked. Fourth thing which you need to check, fourth hormone which you basically need to check is your prolactin, because again high prolactin values again affect your cycles. Your ovulation doesn't happen, and automatically it doesn't let your periods become regular, and neither does your ovulatory pattern gets resumed. So prolactin, thyroid, FSH, LH, these are the 4 hormones which you need to check. Apart from that, sometimes some doctors or some fertility specialists, they do check your estrogen levels also, because there is a possibility that estrogen level goes down. Since your body produces more male hormone levels or more androgen levels, there is a possibility that the estrogen level goes down. So that also needs to be checked again, to know what kind of hormonal supplementation you might be needing in order to achieve your pregnancy. So these are the few basic tests hormonally which you should definitely do before you start planning pregnancy. One more very important hormone which you need to do is something called AMH. So AMH is basically your egg reserve. It basically tells you what is the quantity of eggs your ovary is left with or is going to produce in the coming years, so that you know actually what is your potential to conceive or what is your potential to have a successful pregnancy. So in order to know that, AMH is a hormone which is very important, which you definitely should do. We also do it in young girls, basically to guide them, like how much time do you have? Should you go for egg preservation if you're not planning for marriage, or should you plan for pregnancy as soon as possible in case you are sexually active and you are planning pregnancy. So in that case, it is very important to do this AMH hormone. This AMH hormone gives you a clarity about your egg reserve. It gives you a clarity about how much is the egg quantity in your ovaries, how much your ovary is going to ovulate, how much time do you have, or how much fertility if what the fertile period is remaining. So that gives you an idea. So definitely check this hormone. If you are young, you can still check it, at least to know that your how severe is your PCOS. So AMH also helps in guiding us regarding the severity of PCOS. So these hormones, please definitely check them before you plan pregnancy. Apart from that, in order to understand, as I told you, you first identify the type of PCOS, and we know that 70 to 80% cases of PCOS do suffer from insulin resistance. So automatically, when we talk about management, you need to understand that lifestyle, diet, exercise, these three things form a majority of a basic framework of correcting PCOS. It makes sure that your body has a correct hormonal pattern before you plan for pregnancy. So all this correction does come with this lifestyle, diet and exercise, because it helps in reducing insulin resistance. Because more is the insulin resistance, more is your LH hormone. More is your LH hormone, you do not ovulate, your ovaries become more and more polycystic, and it does affect your fertility. So if you're not going to ovulate, automatically there is no conception. So you need to understand that it's not only that, if you want to get pregnant, you just directly go to your gynecologist, they will give you drugs or injections to make you pregnant. Yes, that is correct. But then you need to simultaneously and continuously keep doing your diet and lifestyle changes. Make sure that your body keeps doing the adjustment in terms of maybe bringing your weight down, correcting your sugar levels if you're already pre-diabetic or diabetic, making sure that your thyroid hormone is within check if you have hypothyroidism. And these all things you will be able to achieve only if you do diet, lifestyle and exercise. If you don't do all these things, automatically it makes it difficult for you to conceive, and it just increases the burden on you only in order to take more and more drugs and more injections to get pregnant. So if you want to avoid unnecessarily medications, if you want to avoid unnecessary drugs, please make sure that you start making those changes, because unless and until you don't come to your BMI range, that is mean you don't lose weight, or you don't control your insulin resistance, or you don't reduce your insulin resistance, or your hormones like thyroid and prolactin, as I mentioned, they are not in check, it will create a hindrance in fertility. It will make it difficult for you to get pregnant, and hence you will need more medications. Coming to medications, so apart from lifestyle, diet and exercise, which actually forms the framework, or which actually forms the basic treatment protocol for any PCOS, even if you're planning for pregnancy, what is more important apart from that in terms of drugs, if we talk about, is we have ovulation inducing drugs. We do give it to women who at the start of the cycle, and we basically give this to make sure that when there are those small eggs, immature eggs, which are there in your ovaries, when they come in the first half of the cycle, at least one of them gets selected and becomes a bigger egg, so that you ovulate. And once that ovulation will happen, it automatically, we tell you the period, which is the fertile period, so that it is easy for you to have, make sure that you plan your intercourse accordingly. And that is done with the help of tracking your ovulation. So yes, step 1 is giving you medications which help in ovulation. Step 2 is tracking your ovulation. So sometimes you do see doctors who track your ovulation with an ultrasound monitoring. So we call it basically a follicular scan. So your doctor will tell you that please come alternate day from your day 10 of your cycle, so that we monitor your growth of the egg. And once they start monitoring the growth of the egg, they tell you when the egg is ready, and then you plan your intercourse. So that is one way of monitoring ovulation. The other way is like the natural way. So natural way means you look for the subtle signs or changes in your body which tells you that ovulation is happening. So there are 2-3 signs which you can look out for. Some are very difficult to appreciate, but yes, some are which are easy to appreciate, and you do understand when you are ovulating. So usually it's the mid-menstrual part, and you do have that like a sticky white discharge which is coming out in the middle of the cycle, and that's a sign of ovulation, that your body is going through ovulatory period, and your ovaries are ovulating. So that is the first sign. The second sign, what you see is basically it's a very subtle sign. It's like a slight rise in temperature, but then it needs a proper everyday monitoring, which is difficult to keep on day-to-day basis. But there are apps, there are There are provisions where you can, record or log in these changes. There are actually urinary strips also available, which are basically called your ovulation kit. So when you pee on that stick, you come to know, when you see 2 lines, oh yes, I have ovulated, because that urine, it has that hormone which records your ovulation. So basically when you pee on your stick, it shows 2 lines, just like how you do your urine pregnancy test. It shows the 2 lines that you have ovulated. So these are the ways by which you can check your ovulation. As I said, naturally, with that sticky discharge coming out, or your change in your body temperature, or your ovulation kit which you can use. So that is the way which you can do at home. You don't need to go to a doctor for that. You can monitor at home. But then usually if you have started with an ovulation induction cycle, or where the doctor has given, they do call you for a follicular scan to basically try and understand which is the day you ovulate. So for some girls it can be 14th day, for some girls it can be 16th day, for some girls it can be 18th day. So as that ovulatory period is there, and usually in the middle of the cycle, we usually tell the couples that from like 2 to 3 days before ovulation and 2 to 3 days after ovulation, so that mid part, you need to have like alternate day sexual intercourse, so that the chance of conception increases. What you again need to understand is that once the egg is released, it is active in your body for 24 hours. And the sperm, your husband's or your partner's sperm is active for 72 hours, 48 to 72. So basically, even if you have like sexual intercourse 1 day prior, the sperm is still active in the body, and there is a possibility that you might conceive. So hence, that's why we tell patients that please try alternate day, and we give them a frame period, or like a window that during this you should try. So that's like how naturally also you can try. And with ovulation induction, yes, there are, as I said, drugs like we have letrose tablet, we have clomiphene citrate tablet. I'm sure some of you might have already taken those tablets, or you might have tried ovulation induction. So these are the drugs, commonly used drug. Apart from that, metformin, I'm sure you all must have heard about this drug as well. It is an anti-diabetic drug. Sometimes doctors do add metformin also as a part of a protocol, because that is known to reduce insulin resistance, and also in the ovaries it helps in ovulation. So sometimes we do see metformin added. Your sugars might be absolutely fine, but that intrinsic or underlying insulin resistance sometimes responds only to metformin, and we do add it along with that ovulation drugs, which helps you ovulating. So that is another medicine which we can give. Apart from that, sometimes if the medications don't work, there is a laparoscopic surgery which we also do in order to reduce the ovarian bulk, or the ovarian, these basically cysts which you are told that, oh, there's a cyst in the ovary, there's a cyst in the ovary. So these are not the cysts, basically, just to clarify that myth. It's basically your immature eggs. So these are your immature eggs which are there in your ovary, which are small follicles, which we call them in medical term. They are not actually cysts, but when the doctor does the scan, they say, oh, you have a polycystic ovary. So don't worry, these cysts are not some big terrifying any diseased thing. It is basically your own immature eggs which are not getting large in size and ovulating. So these small cyst only makes your ovary bigger and larger, and if your PCOS is more severe, there are more number of these small size cysts in your ovaries. So hence we make sure that if it is creating an hindrance and your AMH levels are going too high, or the egg reserve test, and your body in your ovaries are like really androgenic, it is producing too much of male hormone, sometimes we do something called polycystic ovarian, like PCO drilling. So drilling means we basically puncture these small fluid filled a cyst or immature egg, so that the ovarian volume comes down, and it again makes it easy for your ovary to ovulate. So all these decisions are taken only after we have done your hormonal profile, we understand how your cycles are, and when you do make the cycles like ovulatory, when your cycles become ovulatory, either because of the medications, or because of sometimes we do give progesterone supplements also so that your period should come. So these kind of things have to be done to make sure your inner lining is healthy. So these are the common medications which are used, and it's always like a protocol wise or a step wise thing. We never jump to IUI or IVF. If you have heard all these things have come very later. most of the cases of PCOS and who suffer from infertility or subfertility, as I call it, it's not that you are infertile, it's just that the timing is not correct and you're not ovulating, which can easily be rectified. In most of these cases, when we are planning pregnancy and when we are treating pregnancy or when we are treating for fertility, 70 to 80% of them conceive with just ovulation induction. You do not need to go for IUI, you do not need to go for IVF. So please don't get scared that, oh, I have PCOS, so I will definitely need an IVF, or cannot conceive, or I will never get pregnant. These are all unnecessarily created, superstitions or beliefs, or it's basically those all kind of, things which you all keep discussing, and you kind of create a panic situation. It's not like that. It's easy for you to conceive. Yes, it does take time to regularize your pattern. It does take time, as I said, to first identify your type of PCOS and then go about it. But as I said, 70 to 80% of cases just they get pregnant with your just ovulation induction. You do not need any artificial reproductive techniques like IVF or IUI. So I think this is what I wanted to convey, so that you understand that you should not get scared. In fact, you should get your PCOS corrected and then plan pregnancy, which is very easy. And I think what makes Veera very special about in this is, I know you all go to your gynecologist, and gynecologists tell you, okay, go lose weight, go eat a correct diet, control your sugars, and take these medications for pregnancy. The point is, yes, you have to take those medications to get pregnant, to make your ovulation to happen, to regulate your cycles maybe. But then at the same time, if you do not do your diet, lifestyle and exercise, if you do not do these basic correction, and that is where Veera helps, because it's like a comprehensive and like a holistic care which is given under one roof. So it is easy to monitor and manage. It makes it easy for us to track your progress. And once we start pushing you and making sure that you get the dedicated care which is needed in order to take care of your diet and lifestyle, and those things, when they get corrected, automatically your chances of conception keeps increasing. So it's not that it is only the medications will help and it is only the tablets which are going to make you pregnant. No. Each and every effort that you take in terms of your correcting your diet, making sure that you lose weight, even 5 to 10% of weight loss, if you do, that does affect your hormones. It makes your hormonal profile much better and makes it easy for you to conceive. So all these things are important to understand, that it is just not taking medications and doing scans and taking injections. It's not like that. A holistic care, a correction of your lifestyle, diet, along with this helps in achieving your goals of getting pregnant. And one more point which I definitely want to talk about is, especially for young girls, since these days the marriage age is getting late, since these days the age of first pregnancy is getting late. Maybe 1 year, 2 year generation back, it was always like 24, 25 people already used to have kids. So that's no longer the case anymore. Things are changing now. And of course, with that, PCOS is also increasing. We see that every 1 in 5 girls, they have PCOS or they suffer from PCOS symptoms. So we know how rampant this problem is. You need to understand that whatever your goals are in life, of course, your priorities are different. Studies, work, may or may not be interested in marriage, may or may not want to have children. But then in case you have an inclination that yes, one day I would like to, and you are suffering from PCOS, definitely get yourself tested. Do that AMH test to know what's your egg reserve, so that you can take a timely decision. Know about egg preservation also, in case if the need arises, your AMH is low and you are not interested in fertility at present, and maybe it's 5 years down the line. Think about egg preservation. Usually they say that the late 20s and the early 30s are the time when the quality of eggs are good, because after you cross 30, the decline in your fertility happens. That happens for everyone. It is irrespective of PCOS. You will have a decline in your fertility whether you have PCOS or you don't have PCOS. But yes, if a girl at the age of 35 who suffers from PCOS if you're thinking about AMH, or if you're documenting in terms of AMH, if her fertility is say X, for a girl who doesn't have PCOS, her fertility will definitely be more than that. So yes, PCOS does hasten up or does make your fertility go down a little faster. That does happen. But then if you take a timely decision, if you understand and if you correct your PCOS, or if you manage your PCOS on time, and like right from the beginning, from like teenagers or early 20s when you get diagnosed, usually you are at the same level as somebody who doesn't have PCOS in terms of fertility. But you have to keep in mind that fertility decline occurs with age. And if you are a married couple, if you are planning pregnancy, usually we say that try for 1 year if your cycles and all are okay, and if there is no problem. If you have PCOS, you can try for 6 months if you can track your cycles. If you're not able to track your cycles at all, please visit your gynecologist. Try and understand your body, start rectifying your PCOS, and you will see that it will be very easy for you to conceive. So I think these are the few points which I wanted to mention and make sure that you all understand regarding PCOS. Commonly asked questions to me is, oh doctor, I have PCOS, will I be able to conceive? So yes, you will be able to conceive. So I just wanted to put that out. If these questions are in your mind, please ask any questions if you have, so that I can answer it for you. And what I come across common questions, I will definitely answer those. So common asked ones are, will I get pregnant? Yes, you will get pregnant. Do I need to only take ovulation inducing drugs, otherwise I cannot get naturally pregnant? No, it's not like that. There is a full possibility to make you naturally pregnant, but yes, we do have to hormonally analyze you, check your hormonal levels, make sure that your cycles are also in the correct order or correct pattern, and you can basically track them, and you can try on your own. In case if that's not happening, that's what when we come in picture and make sure we give you medications for ovulation. So these are the common things which I come across regarding PCOS. And there are young girls who keep asking questions, do we need egg preservation? Do we need to do egg preservation, or should we freeze our eggs, which is a common thing. So that's what I come across quite often. So it's not always you need to do your AMH to understand your egg reserve. It's not like that. To just let you know, so AMH value should be between 2 to 4. In case if your AMH value is declining below 2, you need to visit your gynaec. That means your fertility is going down. So that's the time when we start advising you, your egg preservation, or you plan for pregnancy in case if you're married. So AMH value less than 2, please visit your gynecologist. So somebody asked a question that what if the drugs are same for making you ovulate in a PCOS and non-PCOS patient? Yes, you are right. The drugs are same. Usually in a non-PCOS patient, they do ovulate on their own. That's not a problem. And in a PCOS patient, since there's a problem in getting getting your ovulation, we have to give these medication. So somebody is asking, because of hormonal imbalance, can we get breast lumps? So see, breast lumps are also something which again we need to address. It's a separate topic altogether, but just to inform you or let you know, every cycle you have that estrogen and progesterone hormone coming, and that estrogen progesterone hormone, it does create changes in your breast. You do see that just prior to your period, some of the girls, they have breast tenderness and breast pain. They feel their breast is a little lumpy. It is under the effect of hormone, and usually it settles down once your period comes. So you need to really identify what kind of lumps they are. Usually you feel like a nodularity and all, or you palpate. If it's not like a hard ball kind of a thing or hard mass you're feeling, your breasts are fine. You should actually do self examination of your breast, especially if there's history of breast cancer in your family. But then you can always check your breast and know what kind of the consistency of the breast is. If you feel any abnormal hard kind of a mass which is there, you should get it checked. Otherwise, little bit like a nodularity growth, or like a tissue, it's basically breast tissue which keeps changing because of the hormone cyclicality every month. So that is normal. Please don't worry about it. Somebody is asking, please talk about facial hair. Okay, so yes, because in PCOS your androgen levels are high, your testosterone levels are quite higher, and these testosterone levels do affect your facial hair, your acne, your hair loss. So these are the symptoms which we commonly see, and they are responsible for your facial changes, or sometimes if your androgen levels are very high, they can cause your voice changes also. So whatever hair growth already comes or happens, that has to be removed. We can't really, there are no medications which will magically remove your hair growth. That will not happen. But yes, once you start controlling your PCOS, as I said, you identify what type of PCOS you have. Sometimes medications are needed to maybe reduce your androgen levels, apart from correcting your insulin resistance, because high insulin levels gives rise to high androgen levels or high male hormone levels. If it starts coming down, you will definitely see a decline in your hair growth. You will definitely see that hard growth which was coming, that at least more and more, like it will not become more denser. It will not be like that. It will become more lighter over a period of time. It takes about 6 to 8 months. It takes time. It's not that it happens immediately, but then slowly you will see those changes. But you have to be consistent in controlling with your PCOS, and then you say. Apart from that, if the hair growth has already come, it has to be removed. Either you do laser, you do waxing, you do bleaching, or you shave. So whatever you want to choose, you can choose as an option. But then the growth which has come, that has to go off. You need to remove it. Unfortunately, there are no medications which will magically remove it. But yes, the rate at which it comes, the density at which it comes, that will go down. So that's for answering your question. There was one more question which somebody asked: does PCOS cause adherent ovaries? So no, PCOS causes bulky and big ovaries. That's what PCOS does. It makes your ovary bigger and bulkier. And the reason that happens is, as I told you, when you don't ovulate, your ovary, just imagine you're not ovulating, your ovary gets sad. Your ovary is like, oh, I'm not ovulating. What should I do? So your ovary, what it starts doing is, it basically starts recruiting many of these small eggs. And because it recruits too many eggs in one cycle, it just makes your ovary bigger and bulkier. So, and that's the reason when the sonologist or radiologist does a scan for you, they see those small tiny cysts. As I said, they're basically immature eggs. So that's the reason your ovary becomes bulkier and bigger, because your ovary tries to ovulate, but it's not able to. And in that process, it just becomes bigger and bulkier because it keeps recruiting more and more eggs. That is the reason your ovary changes like that. It becomes bigger and bulkier, and that is another reason why your AMH or egg count goes down faster, because in every cycle, rather than releasing 3-4 eggs per ovary, your ovary ends up releasing 10 to 15 small eggs. So ideally, a woman is supposed to ovulate like 400 times in her entire reproductive life period. But in PCOS, the egg exhaustion or the egg wastage every cycle is so much, because your ovary tries to, make you ovulate, and the ovaries become bulkier and bigger, that you lose your eggs quite fast. And that's the reason the fertility goes down. That's the reason why your AMH goes down. So when you are younger, if you check your AMH, and if you have PCOS, your AMH will be very high. So your AMH will be like, in your 12, like in the range of your 12, 13, 14. If you have PCOS. If you don't have PCOS, and normal AMH will range anywhere from 2 to 6. But if you do your AMH, say around 32, 35, or if you're having very fast decline of your fertility, your AMH will go down less than 2. So basically that tells what is your ovarian reserve or egg reserve. And since your ovary exhausts its egg on its own so much, the fertility goes down at a faster rate for a PCOS person. So no, you do not have adherent ovaries, you have big bulky ovaries. Adherent ovaries are commonly seen in your in endometriosis. So it does make your ovaries adherent when you have endometriosis, and that's a completely different thing. It has no correlation with PCOS. Neither PCOS gives rise to endometriosis, neither endometriosis gives rise to PCOS. One more common question everybody asks: oh, I have a chocolate cyst in my ovaries. Is it because of PCOS? No. Chocolate cyst is completely different. It is because of endometriosis. It is not because of PCOS. PCOS will just give rise to these small immature follicles, which are clear follicles, which are clear immature eggs. It's just a misnomer that we call it cyst. So unfortunately, you are told like that, but these are just immature eggs. They do not they are not cancerogenic, or they don't become like extra large cyst and all. Having a cyst is a completely different thing. A cyst as in like a bigger cyst, like 4 centimeter, 5 centimeter, that's a completely different thing. And having chocolate cyst is a completely different thing. Chocolate cyst is seen in endometriosis, which is completely different from PCOS. And there is a possibility, yes, that you can suffer from both the things. You can suffer from endometriosis and PCOS at the same time. So in that case, the management does become little different, and it depends from case to case. So those things are there. Somebody is also asking a question, what to do for irregular periods. So as I said, irregular periods is something which we need to first analyze what's the reason. Yes, irregular cycles when you have, we need to first know, is it because of progesterone deficiency? Is it because of you not ovulating? Is it because of thyroid? Is it because of prolactin? Once we understand the reason, it becomes more clear, and we can do the required management. One more thing which I'll clear out for you people is when you have irregular cycles, and for someone who has irregular cycle right from the start, like there is someone who has also asked a question, my periods don't come every 3-4 months and I have done everything, I'm maintaining my lifestyle diet, but still my cycles are irregular. Yes, it does happen sometimes that you are eating perfect, you are in your within your BMI range, you are doing everything right, but still it is difficult for you to get your cycles regular. I do understand there is a subset of patients which exist in this variety and in this profile. The problem in your case is usually these people have irregularity right from the start. Right from the start means when your menses started, when your menarche came. So since your periods have always been irregular right from the start, your brain, which produces that LH and FSH hormone, that is actually not in its correct cyclicality, and it's not in the correct ratio, and unfortunately that is genetic. We can't really change it much. We can make it as normal as possible, but we cannot really change your brain or your genes. We can't do that. And for those genetic PCOS people, yes, this problem stays. We try and maintain your periods as much as possible, in the sense we do make sure that at least in a year, like in 12 months, you have at least 8 cycles. So if you have 8 cycles in a year, or you bleed 8 times, your uterus remains protected, which is something which is very important. Your uterus needs to be protected. Your uterus needs to be your endometrium lining, your inner lining needs to be protected. As I said, damage to that also results in infertility or not able to conceive. So in order to protect that, you should shed your lining, or you should protect your lining, and you should bleed for 8 months. If it doesn't happen on its own, you will need the help of progesterone tablets in order to get either your withdrawal periods, or to basically make sure that estrogen is not causing too much of damage. So yes, there is a possibility that your periods might stay irregular. It's less number of patients who have this kind of a PCOS, where it just doesn't get regular even if you do everything right. You might get your cycle say once in 45 days or 40 days, but there is a possibility that from time to time you might have to induce it. The only reason being stress, your day-to-day lifestyle. There are a lot of factors which affect your insulin resistance, and it is very difficult to control everything and everything to be in the correct parameter all the time. So these things do affect your cycles, but in case if you have this irregularity still, please make it a point that in a year at least make sure you shed at least 8 times. It protects your uterus, it protects you from developing cancer in future. Otherwise, if you are like, okay, it's fine if I bleed once in a year or twice in a year or thrice in a year, no, it's not correct. You have to make sure that you bleed at least 8 times. Even if it's a withdrawal bleeding, you might have to take a progesterone tablet to get your bleeding, but it is important. So please make sure you do that. Somebody is asking that what should be the endometrial lining thickness, or what should be the AMH level to get pregnant. So see, as I said, AMH anyway between 2 to 6 is good, and it does mean that your ovary has good egg reserve. It does mean that there is a good chance that you will ovulate easily. If not on your own, you might need medications, but then you don't need too much of hormonal injection if it is between 2 to 6. If it is higher than 6, that means PCOS is more severe. And one more thing, there is a very good possibility of reversing your AMH or reducing your AMH. If it's like 12, 13, if you control your PCOS. So if your PCOS gets controlled, if you reduce your insulin resistance, if you lose weight, all these parameters go down. Your AMH comes down within normal range. Your ovaries become, your ovaries can become as normal as in size as they can be. Your PCOS reverses. So all these things are there in place, but then, and they do happen with your lifestyle, diet and exercise correction. So if you keep doing that, automatically you will see a drop in your AMH. You will see a drop in your LH levels also, because when insulin resistance goes down, your LH hormone goes down. So it is basically a disparity in your LH and FSH hormone, that irregularity which I was talking about, which is released from your brain if it is not regular. That's the reason why you are not ovulating, and it does get better if you correct your diet, weight and exercise, and you lose weight. So okay, someone is asking, I have not ovulated for last 4 years, can I have chance of getting cancer? So see, it's not like, if you don't ovulate for 2 years, X amount of chance of cancer. If you don't ovulate for 6 years, X amount of, it's not like that. But yes, it's not about ovulation, it's about shedding. You need to shed, and you need to make sure your uterus is getting progesterone hormone. Unfortunately, when you shed after 4 months, there is no progesterone. It is just estrogen lined inner lining of uterus, and that's the reason why it just sheds. And it has nothing to do with progesterone hormone coming and protecting your uterus inner lining, because your body, it doesn't produce enough progesterone hormone. So you might need it from outside from time to time, so that your cycles are, you are getting your periods and you are shedding. It's not that you will get cancer directly, it doesn't happen like that. But over a period of time, say 10 years, 15 years, 16 years, if your cycles have been like that you get only 1 cycle a year or 2 cycles a year, definitely it increases the risk of cancer 6 times as compared to any normal person. And the cancer I'm talking about is endometrial cancer. So you have to make sure that again I'm repeating, you get at least 6 to 8 cycles, at least 8 cycles a year, so that it is easy for your ovaries to function. It is easy for your uterus inner lining to stay protected, so that you don't get the chance of having cancer in future. I think are there any more questions? Okay, they are asking how to manage PCOS, how to regularize your periods. I think for that you need to come and talk to your Veera care manager. You need to get in touch with us. I'm sure if you take a full holistic approach towards correcting your PCOS, it does make a lot of difference. Please don't go for directed treatment. Okay, I have hair growth, I will only take anti-androgens. I have irregular cycles, I will only take progesterone. PCOS is a very it's a complex condition. It affects reproduction, it affects metabolism, it affects you psychologically also. It has a lot of other symptoms apart from just what you see in person in physicality. So you have to make sure you treat it from all corners. When I say all corners, means you need a comprehensive or holistic care, and that's what we do here at Veera. Please get in touch with your care manager. Please check the website. You try and understand what type of PCOS you have, so that it is easy for us to chart out your management, understand how to go about it. And I think for the last 2 years, there are a lot of people whom we have helped in reversing their PCOS. They are about good 20-25% of patients who have gotten pregnant as well. So if you reverse your PCOS, or if you correct your metabolism, if you correct your hormonal profile, it's easy to get pregnant. You not always need IVF or your IUI or any fancy treatment. It is easily done with this basic correction. So I think we can wrap up here. Please keep sending your queries if you have, and we'll make sure that we answer them. Get in touch with the care manager, get in touch with your Veera Health professional. We will take care, we will answer all your queries, and we can do one-on-one, which will be easier, so that we can understand, as each and every PCOS is different. It's not that you all have a common PCOS. Your trigger factors may be different. The reason you got PCOS in the first phase, or you developed over a period of time, might be different. But then you need to understand that if you do a corrected approach, and you do it as soon as possible, like as the more younger you start, the more earlier you start, the more earlier you identify it, the lesser is the repercussions or lesser is the long-term side effects of PCOS that you see. So thank you so much. Thank you for joining. I think I did answer some of your questions. In case if they are left out, please send it. We will make sure we will reply back to you. Thank you.